Hi, my name is Boris Malugin, and I'm happy to share with you fused flange technique of IOL iris fixation. Here is the case of a patient with very unstable IOL capsule bag complex due to pseudoexfoliative syndrome. The areas of optic-haptic junction should be identified and marked on the cornea. Two clear corneal incisions now being done according to their marking. Following that, I take a long needle attached to the 9-0 propylene suture, pass it through the iris, through the capsule, encircling the haptical element, and going out of the eye, as shown here. Same maneuver is done in the opposite meridian, and second instrument is now being used to help me to go out of the eye with this sharp long needle. The next step is to retrieve both ends of the suture. Now they are trimmed to the appropriate length with the Vanna scissors, and the ends are thermal treated with cautery. Cold BSS is used to cool down the area that was treated thermally. Fork-like instrument helped me to dislocate the flange inside the anterior chamber, and the same maneuver is repeated in the opposite side. I'm first creating the fused flange, connecting two 9-0 propylene threads, cooling down the flange with BSS, and insert the flange inside the anterior chamber. Intraoperative OCT is now used to verify the correct position of the implant. Oscillating maneuvers with the wax sponge help me to verify stable position of IOL capsular bag complex. Here I would like to demonstrate you how two ends of the suture are fused together with the help of thermal cautery. You see, this is a nice flange made with two threads, which is quite stable and resistant to mechanical stretching. Respected Dr. McConnell and Dr. Sipser, nothing personal, only business, as I consider this technique is much easier than tying the sutures. Here you can see the eye of the same patient postoperatively. You see that the sutures were purposely left slightly loose in order to avoid distortion of the pupil. However, this is not affecting the stable position of the implant. Fused flange is a novel technique of IOL iris fixation that can be used in a variety of clinical scenarios. And I thank you very much for your kind attention.